And then, you know, we may have a couple others join us, but we have about an hour and 15 minutes for this conversation, and we've got a number of supplemental requests. So I want to make sure that we can move through it on a relatively speedy basis. For our behavioral health leadership coalition partners, welcome to a budget hearing on our behavioral on our 2021 budget for commissioners. And to put some orientation, I know Bob is going to kind of walk through this with the budget priorities, but I want to remind commissioners that we have we keep a very detailed spreadsheet that outlines our budget and actual priorities related to behavioral health. And those are all under your orange trends and analysis tab in your budget book. And it is the extensive we have to fold it over and include it in the book because it's so big. And it has both what we spend. These are funds outside of community partner funds and alcohol tax funds, which I know like DECA receives. So these are funds that have been specifically designated from property tax for behavioral health, and then the new mental health sales tax. Both are accounted for on this spreadsheet with multiple years of forecast. So this is affectionately referred to around here as Bob's spreadsheet. And we keep and we have a lot of detail on it. So Bob's going to walk you through more of a summary of what our priorities are for this year. But if you want to see how this has evolved, how we've moved, we're trying to align expenses in the property tax side versus the sales tax side in a way that allows us to accommodate it and monitor it and provide oversight here at the here in administration. But there's a lot of moving parts with this budget on a lot of different initiatives. Any questions from commissioners before I turn it over to Bob to kind of walk through this year's priorities? I'm not seeing any, so take it away, Bob.
Thank you, Sarah. You know, and I was preparing for this over the last couple of days. I was thinking this is I appreciate everybody being on the call this morning because it's an opportunity to take kind of an unwieldy set of priorities, aspirations, and allocations and try to give it some focus. So what I wanted to do for a very short period of time is give you what I think is an overview and a summary of how the Behavioral Health Leadership Coalition partners have been talking about budget priorities as they relate to achieving the aspirations of the community health plan. So I am going to share my screen with a document that I have shared with the Behavioral Health Leadership Coalition and also with the commissioners. And you know, we have these sort of three focus areas of the community health plan: prioritizing prevention, promoting integration across the system of care, and improving access to care. What I want to do is I want to walk you through kind of the priorities under each of those focus areas, and then at the bottom of this to kind of summarize where we see new spending required in 2021. And there are a couple places in the spreadsheet where we have made we are moving where these projects land and live. From mill levy in some cases over to the behavioral health sales tax, and in some cases from the behavioral health sales tax over to mill levy. And I can explain that as we go and try to resolve any confusions or questions that you might have. So under prioritizing prevention, we have a number of things that we're doing and a number of new initiatives, but what I want to say is that that work all continues to live within the frame of about $177,000 that is allocated to DECA to manage this realm of what we're doing. So under that area of prevention programs, we're talking about maintaining funding to support strategic planning, data sharing and analysis, and project pilots that address substance use and suicide prevention countywide. That includes expanding the MyStrength user base and continue to offer MyStrength to all the residents of Douglas County. supporting DECA as they pull together the Engage Douglas County Coalition. They developed the Douglas County Youth Prevention Board, continuing to support the Behavioral Health Summit that will happen this year in July 27th, beginning July 27th. And then a couple of pilots now that we're getting into the implementing strategies to address our prevention priorities. One of them is the Good Behavior Game. That is an elementary level program that targets kind of providing, well, I'm just going to go through these quickly because of time. So piloting the Good Behavior Game, piloting Sources of Strength, which is the suicide prevention strategy, continuing to implement Handle with Care with our law enforcement partners and each of our school districts, and supporting tobacco cessation and anti-vaping initiatives. There's no new increased funding in our proposals under prevention in 2021. Under promoting integration across the system of care, there are a number of significant adjustments and new projects and new programs. One is something that we've been talking about for to get more sophisticated and intentional and focused in how we gather, analyze, and share data related to our behavioral health projects and initiatives. And so in the health department's budget request, you have a supplemental request to fund a data sharing prototype that would be kind of a joint project between Behavioral Health Leadership Coalition partners, Public Health, and KU's Coffrin Logan Center, which will actually be doing this work. That's a $30,000 request to support the cost of that prototype, and we have that on the behavioral health sales tax. We spoke with you during study session 2 weeks ago about plans for the integrated crisis team and wanting to expand the workforce, integrate peer support into what we're doing across the system, piloting mobile response, and again, gathering data around outcomes to get out into the community and to be ready to have the workforce that we need in the Turning Point Recovery Center. So what we're proposing to do in terms of funding for this is to reduce the base funding for the LMH team to accommodate the addition of a full-time peer mentor in the ED staffed by DECA. So we would move the base funding for the integrated crisis team out of the mill levy and onto the sales tax. Then we are proposing that we expand and enhance the ICT as we outlined to you and integrate the workforce that'll move from the emergency department to the Turning Point Recovery Center in 2021. We estimate that the cost for that would be an additional $266,000. The startup costs, because we would like to start this in 2020, would be offset by sales tax dollars that have been targeted for mobile response in the 2020 budget. And then additional staffing costs for this work would be absorbed in the Turning Point pro forma in 2022. So what we are trying to do is to continue to build on the work that's being done with the integrated crisis team, increase staffing, access center hours, redeploy peer support so that we are building that workforce that we will need, that we anticipate to need in the crisis center. And the cost of that will get absorbed into the operating costs of the crisis center as that entity comes online in the joint partnership between Burt Natch and LMH. We want to continue to support staffing plans that promote integration and maximize opportunities to recover revenue via crisis code billing, and we want to develop strategies to move toward a true 24/7 crisis response in the emergency department, at Turning Point Recovery Center, and post-crisis care coordination in the community. The Douglas County Peer Fellows Program has a small increase to support the number of peers that we have scoped and peer supervision. That program will continue to kind of expand its impact in the community at various community sites. That is part of the budget. In supportive housing, we want to provide operational support for transitions. That's a new expense in 2021. We want to continue to support the Artists Helping the Homeless Kairos House projects. Remember, we scoped that out for a 3-year commitment when we proposed it to you last year. We want to support transitions in the cottages with intensive care coordination and intensive case management services. We want to explore capital support in 2021 for a potential housing project in 2022, as we've discussed over the last couple of years with DECA and at Lakeview. So those are the kind of priorities under the supportive housing area. And then integrating the 24/7 crisis line and expanded mobile response. There's a work group that has been stood up under the Criminal Justice Coordinating Council. And with input and support from the integrated crisis team, there's been a lot of conversation about where we go with mobile response. And what we have in the budget is a placeholder to accommodate doing that work as those plans become clearer coming out of the CJCC and the BHLC. So those are the new initiatives and the priorities under improving, promoting integration across the system of care. Under improving access to care, we've made a lot of progress with psychiatric infrastructure. We're going to reduce the psychiatric supplemental to $500,000 in 2021. And the major shift is a reduction in the funds to support psychiatry at Burt Nash to accommodate additional psychiatry capacity at Heartland. So we would support Heartland's acquisition of a full-time psychiatrist with the same graduated funding tier adopted for all of the psychiatry positions that we've supported since we started doing this work in 2018. Heartland will sustain 1 FTE of psychiatric APRN to maintain the county funding between 2021. And then Burt Nash, we are proposing to eliminate county support for 1 APRN position because that position is now self-sustaining. We're proposing to reduce the gap funding for the original psychiatrist position in 2021 so that it aligns with the funding kind of tier approach to all the other positions we've supported, so that the funding for that and for the gap between revenue and expense would not exceed 40% of the salary and benefit cost. Continue the 3-year funding plan to support the 2 psychiatry positions that came online last year. So that funding plan is 60% of the funding gap in year 1, 50% of the funding gap in year 2, 40% in year 3, and then continue to support the physician's assistant position as long as it fits within Burt Nash's allocation for the psychiatry supplemental of $320,000 in 2021. Under SUD programs, we want to continue to work with community partners to expand smart recovery throughout Douglas County. We want to continue to support the Regional Social Detox Access Project. We'd like to expand coverage hours and locations in partnerships with DECA, LMH, and Heartland Community Clinic. We want to continue to provide supplemental funds to reduce disparities and support for SUD treatment for men. We want to explore and refocus strategies to address SUD goals in the community health plan. And so what we're proposing to do with the social detox project is to move the funding for that from that project from the mill levy over to the sales tax in 2021, and to add some additional capacity in that project to increase the number of people served by about 40%, and to support the embedding of a full-time peer, 8 hours a day, 365 days a year in the emergency department. Under care coordination, we are proposing in 2021 to expand, as we've talked about, from 3.5 FTE in 2020 to 4 FTE in 2021. We want that team to support transitions, the cottages, the community shelter with the intensive care coordination, and provide potential peer-supported transport to RSI in 2020, 2021. So if you look at those priorities, there are a couple places where there are significant or different increases in terms of spending. One is a placeholder for the projected startup and operating costs of Turning Point Recovery Center. We have a pro forma that we are working from that has been developed by our partners that provides kind of preliminary cost projections that we would like to come back to you in August and start to really drill down on the details of this. But what we're proposing is that we have a placeholder of $1.875 million in 2021 so that we have the funds that we need to start up and to begin to bring the operations online for Turning Point in 2021. The data repository prototype, like I said, is $30,000 on the behavioral health sales tax. Transitions is $180,000 on the behavioral health sales tax. The intensive care coordination service would be an increase of $50,000 in 2021. So the full team would cost $380,000. That will move to the mill levy. The integrated crisis team expansion would be an additional $266,000 on the mill levy. And then the social detox project, the supplemental is a proposal for an increase of $104,000. The actual additional cost of that, if we reduce the base funding for the ICT team at the hospital by $50,000, is $54,000 on the behavioral health sales tax. And then there's another placeholder without a lot of definition at this point to be able to fund and support mobile crisis response pilots, as we've started to talk about with you and also through that work group. So I just threw a lot of information at you. I will stop there.
Does anyone have any questions for Bob?
There, I just want to make, so when we're looking at, this is Patrick, when we're looking at our budget options here, right? All these things that have the double asterisks are a lot of what Bob just walked us through and have already been included in the budget. Is that right?
Correct.
Okay, just making, that's what I thought. Just making sure. There's a lot of news and difference and things like that there, and I just wanted to make sure I was still tracking.
Yeah, if it was, yeah, if it's a double asterisk on the options page, it was already included in the proposed budget. And as just to explain a little background for folks that haven't been with us the whole time, my general rule in preparing the proposed budget is any sort of new program or expansion of program would not get automatically put in the proposed budget, but because we are in the process of implementing a number of initiatives associated with behavioral health, some of these were planned and have been outlined to the commission as coming online. So those are why they're included in the proposed budget. And they're outlined on the option sheet, and commissioners have a lot of detail on them in their budget books.
Thank you.
There are some, and if we, we could if there are no other questions, we can transition to those conversations to discuss the requests that are not included in the budget book and or in the proposed budget, I should say, and discuss those if there are no other questions. Bob, can you, let's see here, I might have you, yeah, thank you. Does anybody have any, and have any other questions? Bob did a great job of lining. Oh, Nancy, go ahead.
I don't really have a question. I just wanted to make a comment that boy, that presentation represents so much work, unbelievable number of hours of meetings and careful, navigation through lots of different parts of the budget. And it just reminds me how vitally important that early $1.9 million dedication to behavioral health, those funds before the sales tax, those really have come to be the kind of incubator for all the good things that you and all the partners are doing for the community in advance of the crisis center. And it just keeps spinning off more and more really productive programs. So I'm grateful for all the work, for such a concise presentation. It's kind of breathtaking, really, and that it's already in the budget. That was great. Thank you so much.
So if there's no other questions, I think we could begin to review some of the supplemental requests that are not included in the budget. And in terms of the commissioners, how we've outlined it in their budget materials, we handle that in alphabetical order by name of the community partner. So we could start with Bert Nash. Under tab 7, the commissioners will find the request from Bert Nash for conversations about just general community partner funding and RAP. So that is under tab 7. Now I'll turn it over to Patrick and Mike.
Thank you. Thanks for the time this morning. We really appreciate it. I will actually have Mike walk us through because this is something he worked on tremendously. So, Mike.
Yeah, good morning. Thank you for the time. With regards to the supplemental requests here for the general funds, what we were looking at is these would be the services that we provide to the county, the residents, those that, you know, are more in need, whether they might be unemployed, which we have a lot of those folks right now, as well as people who have lower income and having access to those services would not be available for them were it not for the subsidized funds and the sliding scale, as well as the fee waivers that we provide to these clients coming in from Douglas County. When we looked at our numbers, and I've got a supplemental request here, a page for that's titled Douglas County General Fund Supplemental Request. The total dollars that we are actually spent in 2019 as far as writing off or waiving fees, sliding scale, came out to be $1,523,000. We currently receive $819,500 from the county, so that left us with a gap of $834,536 in 2019. When we look to 2020, we've done a couple things. We've taken some of our more common services and we've tried to make those a little bit more affordable at the upper end. So someone who say was at the upper end of the sliding scale, they might be paying $175, which is the normal price cost for those services. We are reducing those down to $140. And part of the reason for that is we're hopeful that not only will that make services more available and easy for people to access, even if they do have some income and are at the higher level, but also that it would attract private people with private payer sources. So it wouldn't just be people paying cash out of pocket as in self-pay, but it would be people who might have a private insurance company and maybe are seeking services right now at a private provider. They could come to Bert Nash and get those services at a little bit lower discount, and we would also gain access to those funds and the private payer sources through that. So with that in mind, 2020, we've taken basically our same level of services. We've taken the rates that we're going to be charging. And by the way, those rates for the higher end were reduced here May 2nd of this year. So it wasn't too long ago that we reduced those rates. But the gap we were looking at for 2020 is $417,205. With the 2021 budget, excuse me, with the 2021 budget, the county has been talking to us and we are looking at trying to make our rates that we charge to the county in line with Medicaid rates. One thing there with Medicaid rates, as you know, a lot of those have not been increased for several years. So there are some services which do not pay out real great on the Medicaid scale. But when we did apply those Medicaid rates, we came up with a gap of $92,136 in the year 2021. We anticipate that services will continue to increase and the demand for those sliding scale and fee waiver services will continue to increase as they have every year. And certainly in this year, we're going to see more than what we've already projected here in 2020. With that gap of $92,136, we are asking the county here to consider increasing funding by $115,000 in 2021. That would give us a total of, let me go back to my budget here. That would bring the funding from $819,500 up to $935,000 in the year 2021. And just for reference, that $819,500 has been the same level for about the last 4 years while we've continued to see steady increases in demand for services in this area. I'll pause here for questions or.
Yeah, there's just a couple things I want to add to that, Mike. You know, I think the commissioners are aware that we aligned our community partner funding with sliding fee scale over the last couple of years. So I guess I feel like in fairness to say, I don't know that it was ever the commission's intent to make up the entirety of the sliding fee scale. And before a few years ago, it just was community partner funding to do good work in the community. And so I want to just be cautious about us, how we would approach that notion of the county's responsible for all sort of gap in fund service, gap in sliding fee scale services. And I don't know, Mike, if you could just, you ran through a lot of numbers there really fast. If you could, where all of your sliding fee scale dollars come from. I know it's a complex mix of, insurance charges and private pay and all of those things, but.
Yeah, the sliding fee scale would be based upon their ability to pay. And so in some cases, they may have a private payer source, and we will always seek out, obviously, the private payer source first. But where those come in and they fall short, even for the clients, at that point, we look at those clients and based upon their income, we'll put them on a sliding scale if they have additional dollars that they need to pay out. The bulk of our services probably are within the self-pay category. We are seeing quite a bit of increase in the fee waivers currently in the current environment with the COVID. We've seen probably doubling or tripling of the fee waiver requests. But in terms of the sliding scale, self-pay is our largest category. I was going to look here for the commissioners. There's a 2019 Douglas County annual report. And within that report, there are some pages that refer to the sliding scale. And I'll see if I can give you that page here in case you do want to look at it. Looks like pages 11 and 12 of that packet. And the larger one would be the self-pay on page 12. And this would be those clients, most of them who just have no other payer source. They're paying out of pocket for their services. And so they come to us looking to receive services. The largest ones, we have CPST, special individualized therapy, initial assessments, individual therapy, med checks is a big portion of that.
Mike, maybe I can I want to reference for commissioners, that report that he's referencing is under your Bert Nash tab after all of your request forms, and it's the Bert Nash annual report, and it's got the nice pretty blue Bert Nash logo on the front. So commissioners should be able to find it after their Bert Nash tab. And I would actually highly encourage, at Mike's team and Patrick's team and Stephen's team put a ton of work into this, and he's got some great outcome performance measures for the number of people served and the work we're doing in this community. So, in your spare time, I highly suggest you take a look at this. Go ahead, Mike, sorry.
Sure. No, thank you, Sarah. And Sarah pointed out, it was not the intent of the county to cover all the expenses and costs, and quite honestly, Bert Nash has been putting in a large portion, as pointed out on the supplemental request page, which I ran through the numbers pretty quickly, but the gap in 2019 was $834,000. Gap in 2020, we're expecting $417,000. And then the gap here in 2021, we're looking at $115,000. And like I say, part of those numbers going down is because Bert Nash has been eating some of those costs in that area, and with lowering the amount that we're charging at the higher end for, say, people who are not on sliding scale, but are at the top end of that, whose income doesn't allow them to hit the sliding scale ranges. And just to give you an idea, for sliding scale, we do it based upon poverty levels. And so we're looking at 100% poverty, 200%, 300%, and so on. And that's how a lot of the CMHCs in the state of Kansas do that. And we actually revamped that scale here just this last year to look at and make sure that we were falling within those guidelines, and could then update each year based upon the poverty guidelines that are put out by the national level. As far as coverage is concerned, I would just say in this area, Bert Nash is looking at taking some reduction in fees here in the 2021 budget season, psychiatry being a large one. We're looking to have a decrease of about $146,000 in funding for psychiatry. We are not at this point anticipating any reduction in costs for providers that we currently have providing those services. So that is going to be the hit to our budget. And I would just say that with hits like that, it makes it harder for us to be able to subsidize, areas such as the sliding scale. And so at some point we might have to look at limiting those services if our budget doesn't allow for it. Questions?
So, Mike, this is Patrick Kelly.
Yeah, Patrick.
So, understanding that the amounts are going down, you sort of articulated that, right? That you're adjusting your cost model so that the amounts are going down. I mean, one of the things I think about as a commissioner when I get a supplemental request is how long will this supplemental request go on, right? So if it's 100 and if this year's supplemental request is 100 and oh, sorry, 140,000, right? And I know that includes some Bert Nash stuff. Will we need to come up with that 140,000 next year and next year and next year, right? So can you make any sort of project? I mean, we may be able to do something, short term, but do you see this being a continual issue down the road? I mean, I guess that's my concern is that, how long will we need to fund that supplemental request? How many years will that be needed?
Sure. Patrick, just to clarify, is your question, would the 115,000 be then we request it every year, or would that 115,000 continue to grow and be, say, an additional 50,000 the next year and the year after that?
Yeah,
so instead of 115, 165,000 or?
Yeah, you're getting to my concern. Yeah.
Okay. Okay. Yeah. Good question and hard to answer, obviously. I would say that, we have continued to see demand for services go up every year. And obviously, the more payer sources we can add, we've contacted with a couple of private insurance companies just this last year, which should help reduce some of the demand on that particular budget and funds. Also, our hope is, like I said, with reducing the higher end, like I say, the $175 per therapy session to $140, we'll gain some of those private payer sources who have a private, say, insurance company, commercial insurance company or something. And by doing that, that also helps to bring in additional revenue dollars so we can take the strain off of the increase we're seeing in the sliding scale on the fee waiver. I will tell you right now, in the current COVID environment, there is no doubt a lot of need for behavioral health services out there. We have not seen the dramatic increase that we are expecting to see, but we know that it's going to come at some point. Bigger concern is we are anticipating a lot of those people will be people without the ability to pay. It's going to be people that are unemployed, people who have been furloughed and do not have ability to pay. So even though we may see a higher demand for our services, especially in 2020 here, we expect that they probably won't have the means to pay in a lot of those cases. I can't obviously predict the future, but I would hope that 2021, we would see maybe a leveling out of that and that demand would go down again. But I know that we're hopeful. I think Patrick and Stephen both agree that by us adding the private insurance companies we have, by lowering our fees and attracting more private payer source to come in, that we can reduce the demand on this. The 115,000, we've managed on the 819,000 for the last 4 or 5 years, and we just felt it was time that we needed to ask for some additional sources. But I think that going forward, the hope would be that 115,000 would provide for us for the next couple 3 years.
Patrick, if I may, I think this is part of the challenge is how do we continue to expand the amount of services that we provide on the same dollars if many of those people coming in don't have resources. So it's a matter of how do you move forward and do more with the same dollars. And so trying to work through that, and the best way of doing that is part of a need for a longer term conversation than we have here this morning. So.
Okay.
I would be remiss if I didn't bring up one of our favorite topics that I know we will eventually get to, once we things calm down, and but is Bert Nash's health insurance. it is important to note that our increased funding for health insurance has gone up significantly over the past few years. And really that's where the county has put its emphasis on increasing the funding amounts. So I do think it's important for the folks listening to know that our support for Burton Ash has gone up in that area significantly over time.
Sarah, and I hate to bring this up because for those of you who haven't been in on all of our budget hearings so far, and why would you want to? You know, some of what I hear from Mike and Patrick is related to COVID-19, you know, that we're seeing a large number of unemployed. And I hate to lean on CARES Act money again and again, but I'm hoping that at some point, you know, we'll talk about the, you know, is that an opportunity? And you know, there's just so much that we don't know about that funding, or maybe you know it, but we don't know it. Somebody knows it. So do you want to share anything about that, Sarah? Is that fool's gold to continue to chase CARES Act money? I mean,
not necessarily. So, and I'm going to jump off budget hearings at 10:30 to jump on the recovery team call to talk about the first phase of implementation for our CARES Act funding. But the first thing to state with it is it's one-time money. So it could not fund supplemental requests ongoing to support, you know, like the wrap worker, you know, trying to cover the cost of wrap workers. I'm not sure that would be an appropriate use of it. Now, I don't think these two particular requests could necessarily be applicable to CARES Act, but a request from Burton Ash and other behavioral health and health providers in our community about the impact of COVID-19 on their revenues and their business model as a one-time infusion of cash to help offset those is something that I think is a possible part of our plan for our CARES Act funding. And I would highly encourage our partners that are engaged in that work to stay engaged with the recovery support framework for health and medical, which is currently led by Sonia Jordan in the health department and Tracy Hoopengardner, correct, Dan? And Russ, and Tracy is helping Sonia with that work and the recovery support framework. So we're going to talk to those folks today here at 10:30 about what we have available there, but it's not going to necessarily be these particular requests. I just want to be clear on that.
so I want to give Patrick and Mike, and I feel like I'm totally hogging the conversation, so I apologize for that. But Patrick and Mike, have you put any thought into that? You know, have you put any thought into making a proposal that's CARES Act money instead of a supplemental request?
You know, since we don't have the details about the CARES Act and this packet was due weeks ago, it's hard to, you know, if we need to pivot, we can certainly pivot. Mike is constantly looking at information out there about the different CARES Act related programs. So, you know, we're willing to look everywhere possible for pennies under stones. So,
Okay.
And I appreciate that. And you're right. Patrick's right. This was all due in March. We are still trying to get good CARES Act information out. I have lots of questions. I'm going to get lots of questions and not have all the answers in the next couple of weeks on that. But I would encourage, I know Burton Ash is already engaged in that recovery support framework and be looking to that team to help provide you with information on what we're going to need in the next 30 days.
Thanks. I'm just looking for ways to make our decisions easier, obviously, and, you know, chasing every.
absolutely.
I do think, I mean, I know we've others to get to, but I do think it's worthwhile talking a little bit about RAP. And so Mike, if you wanted to specifically talk about the RAP request, and I think that would be helpful.
Yeah, You bet. So when it comes to RAP, obviously, we're very supportive of the program. We think that, and I think a lot of the folks on this call would agree that catching people early, getting them the service they need earlier on, certainly not only improves their quality of life, but also on the back end helps to reduce the cost of those emergency rooms and hospitalization things later. Not to mention, within the classroom, not only does it help the student catching them early on, but it also helps the rest of the class, the teachers, the whole environment there when you can provide services and come alongside these folks and support them. Currently, Burt Nash is contributing about 10% of our overall RAP budget to this program. We get additional funds from the county, and then the city is the other source. It's the major sources of funds for the RAP program. This year, we had a shortage of about 18,000 for 2020 is what we're looking at. And that includes adding an additional supervisor within the RAP program. We currently have one supervisor to manage 17 RAP workers, and you can imagine in 17 RAP workers and probably 20 plus schools, there's a lot of challenges that come up, a lot of management, a lot of supervision and training that is required. And so we have had to use one of our directors here, the Child and Family, to provide some of those services, which then, of course, takes her away from other vital programs within the center. And so, but with the budgeting the way it was, having an $18,000 gap in 2020, we opted to not add that additional RAP supervisor until mid-year to help save on costs there. So in the 2021 budget, where we're looking for be a $61,000 increase over the 2019 budget, I'm sorry, 2020 budget, a large portion of that, about 40,000 of that would be just for the additional RAP supervisor, which would be a full year as opposed to a half year. And then the other 15,000 would be for just the normal cost of living or increases that we typically have in that program. One of the challenges we've had, and I know in the COVID environment, again, we did this budget back in March. In the COVID environment, things changed. A lot of places are actually freezing wages or lowering wages, and we are not immune to that as well. But on a good year, in a given year, we in the past have not always done those cost of living increases, and then we found that in many cases, some of our partners would start programs, projects where they're hiring other folks similar to our staff, and all of a sudden we find out that our staff is underpriced, and we start losing them to these other partners within the community. And so it's important for us to try to stay in some kind of a level of competitiveness, and that's where part of the cost of living was factored into the budget for the 2021. We usually have about a 2 to 3% cost of living increase is what we try to factor in for our folks. With the 18,000 shortage in 2020, you add another 43,000 in 2021, and that's where we come up to the 61,941 increase we're asking for. And as I put in our notes here, obviously I know the county's budget is difficult, just like ours is, and you have choices and many projects and things to allocate to. We're not saying that we would want to go this route, but it's just a reality. If we don't get the additional funding, then we would need to look at probably reducing the number of RAP workers in the schools. We are requesting additional funds. We're looking at with the city. We will be working with them. We are also reaching out to school districts, and because as you know, the school districts currently really do not participate or put any money towards this program, even though they're reaping all the benefits from it in most cases, or a lot of the cases. And so we are certainly trying to find other ways to collect those monies, but in the current allocation, we have 10 workers assigned to the county, and if the funds for the supplemental cannot be gotten, then we would probably look at reducing at least one RAP worker in order to make us whole there, because we just anticipate 2021, we're going to have a lot of additional requests, needs, transitions is going to be one where we're going to need to add additional monies to, and with those additional requests, we just don't have the money to continue to fund 10% of the RAP program going forward. What questions can I answer for you?
So I have a question about that, Mike.
Yes.
It's Nancy.
Yeah.
And it's kind of a question for Bob as well. So one of the things we promised the community was more wrappers in the schools around the county, not less, as part of that sales tax initiative that was passed. And so that those new tax dollars do provide for more wrap workers in the high schools, I believe. So Bob, I'm wondering.
And middle school.
I'm sorry, and middle school. So I'm wondering, Bob, is there, was this need for a kind of extra supervisory capacity part of your consideration in the budget that you already have, or is that not something that we can support with that budget, or what's your thinking on that?
It is not something that we considered within the frame of that budget, just given the new funding that was added last year, $260,000 to increase that. Then my understanding, and maybe Patrick and Mike could comment on this a bit, but I felt, we went through a joint MOU process with the school districts to make sure that we were trying to kind of align the impact and expectations for those RAP positions. And one of the adjustments I thought that had taken place through that process was converting some of those positions, which were 12-month positions, to 9-month positions to, in effect, offset some of the cost of living adjustments that had not taken place over the last couple of years. I would be curious, I'm curious to understand kind of maybe what the impact of that was, because if you look at that, which was kind of facilitated by the county to talk more strategically about RAP and what it costs, and then to add, $260,000 last year to support those new positions, I think you could say that, the county made really a significant step forward in trying to increase capacity and to meet the costs that were projected when we went to the community for that ask for that extra capacity.
Right. So that the extra capacity is what allowed us to put RAP into the rural, I'll call it rural school districts, where it had not previously existed. And yeah, moving to a 9-month calendar or a 10-month calendar for the RAP workers certainly was a benefit, because then it mirrored more what they are seeing in their colleagues at the school district and the school year. But even then, they can get hired away by a school district at a fairly significant increase if they chose to. So even though we were able to give them a better calendar and we've kept up or we've been able to improve their wages a bit, they're still lower. So again, it's that attempt to continue to move forward instead of what I discovered when I came here at Burt Nash. We had neglected taking care of our staff for years, and I had to make up such huge amounts to get people to even be close to what the market was. And so that's what we're trying to do, is keep us moving forward, so we're not playing catch up after 5 years and losing people who get hired away at a significant increase for them. So I think that's part of it. And again, part of your funding previously and continues to have been what supported the USD 497 positions. And those are positions that, again, over the course of time, if we haven't been able to take care of strong and well enough, that we're trying to make up ground on some of these years of not catching up. And we don't lay this entirely on the county. That's why we're talking to the city. That's why we're talking to the school districts and saying, hey, how else can you support us with this? Because what we discovered when we really did a deep dive, I always had in my head that Burt Nash provided about $50,000 for one position in RAP. And what we really discovered when we looked at it, we're providing, what is it, Mike, $100 and some thousand dollars.
About 120, 130, yeah.
$130,000 of our endowment every year. So we were no longer funding just one position. We were funding a lot. which takes away money from the other things. And we only pull out about 240,000, give or take, out of our endowment every year for support. So a growing number was going towards supporting RAP. So we're just trying to make up some of the ground.
One of the things I think we could perhaps do in the future, regardless of the funding of this request or not, the sort of ongoing care and feeding of the RAP program, I think is a topic that, we should continue to discuss with superintendents and other community partners. And, I was looking at the contacts, and I know this year's a rough, in the data in the annual report that Bert Nash put together for us. And I think as we bring the rural districts online, there's going to be some balance shifting here between, the number of contacts. And actually, I was incredibly surprised to see how many contacts were in the Perry-Lecompton School District. Probably one of the highest, at least like when I was looking at 1 month. So it's not representative, but I think conversations about that and how the program could be structured and supported. I do know it works closely with school district social workers who do tremendous work in our schools, and they see value of having both RAP and social workers that are, so I think it's one of those things that as we talk about how does the community support this program, we clearly have some work and refining to do. And I do appreciate that Bert Nash is in a difficult position that his costs keep going up. How do we support that? But I don't know right now how we make that an easy, just, cost of living goes up and one partner pays situation. So. We have about.
We've got to get on to something else, but Patrick and Mike, Sarah's proposed budget does not include a raise for our county staff. And so with that in mind, do you still feel comfortable making a supplemental request to provide what you're calling a cost of living increase or a raise for our RAP workers? Does that still feel okay? And then my second question is, if we went to 9 months, why are we doing a year-long supervisor? If we reduce that, the length of, what are they supervising if RAP workers are not working?
In terms of the cost of living, yeah, in the current environment, I think, I think I mentioned maybe 15,000 of that request is for cost of living. At this point, I think we would be happy just to restore the pay cuts we've done come next year, at the beginning of the year. That would be at minimum our goal. As far as whether or not we do another 3%, in the current environment, I'd say that's probably not very likely. I doubt that we would, so I think there is some savings there. The larger portion, the 45,000, would be for that supervisor, and as you pointed out, yeah, they would only be needed, say, 9-10 months out of the year. But it's also hard to find someone who only wants to work 9 or 10 months out of the year and not be paid for 2 months out of the year, especially in a supervisory role. And I'm sure, I don't know enough about the clinical side of it. Patrick may be able to jump in, but as far as those supervisors, I would anticipate they're doing some planning for the program. They bring people in for training and all prior to the schools opening up. And so I would suspect that those supervisors are doing some training and things during the off months.
I would say they're akin to a school administrator at times, who, while their teachers are away, there's still work they're doing over the summer, albeit maybe different. So.
I feel bad, but I want to make sure that we have sufficient time to review the request from Heartland and Douglas County Dental Clinic. As we're transitioning over to that with Robin and Julie, I did want to just clarify for commissioners. So Heartland had 2 requests. One of them for psychiatry was included in the proposed budget as a part of our psychiatry effort. And Mike mentioned it a little bit earlier. We have really empowered the Psychiatric Infrastructure Committee to help make sure we make really good decisions on psychiatric expenditures. And our hope is that as we bring providers on board, we are kind of a starting, I don't want to like we help, there's some sort of fancy economic development term for it that I can't think of at the moment, but that we provide some initial funding for that position. Then as that person gains clients and reimbursements, that they're able to better support themselves ongoing. So that's how we've really designed the psychiatric infrastructure program. And this year it's an opportunity for Heartland to sort of bring a provider on and have that support. And then as the program grows and that person gets more stable, the need for their subsidy becomes less. And that's similar with the other partners in that room. So if I don't know, Robin, if you want to have Julie go first, or if you want to, okay, so Julie, maybe you could just talk to us a little bit about, it's a relatively small request for help in defraying costs associated with the Heartland merger, and it's on tab 9 for commissioners.
Right. Thank you so much for having us today. So as Sarah said, our request is relatively small. It's a one-time request to help defray costs associated with our merger that is scheduled for August 1st with Heartland Community Health Center. We anticipate costs associated with the merge to exceed about $50,000. That would include things like training, IT, and lost production during a closure that we would have for about 3 days during the merge time when we're training new providers on Heartland's electronic dental record. We're asking for a one-time supplemental of $2,250. We're looking at other revenue sources as well to help defray those costs, including the CARES Act Medicaid provider funding and private donations. So again, it's a relatively small request and one time just to help defray the costs that would be associated with our merge with Heartland.
Does anyone have any questions for Julie?
Hi, Julie. Thank you. Sarah, I have a question. This is a relatively small request. And it sounds like, Julie, I think you said the merger is going to occur around August 1st. Is there anything within our 2020 budget that we have $2,250 that this doesn't need to be included in our 2021 budget?
Yes. I mean, commissioners, we put all requests that we receive at this time through this process. So if the commission wanted to, we could fund it in 2020 and not 2021. However, as I mentioned before, my philosophy in preparing the proposed budget is to not put any one penny of new programs or additional expenses into the proposed budget. I believe that's a decision of the commissioners to make those expansions of service. So, but it is something we could do in 2020 if the commission decides to do that.
Okay, so then if this was something we wanted to discuss, can we do it outside of our budget deliberations and do it in one of our like regular Wednesday meetings?
Well, I mean, and I know this is a relatively small request, so 2,200 is not necessarily going to massively change our projections for fund balance in 2020. However, you know, we have some other one-time requests that might be coming through, and generally that's what's valuable to have them in this process, so that if we plan to spend it in 2020, I can make the accommodations and fund balance for 2021.
Right. Just asking.
Yeah.
If after we hear from everybody, if there are some that we just want to go ahead and take care of out 2020 budget, is that something we would just bring up during our regular Wednesday meeting, or?
I would prefer to have a discussion during deliberations over the next couple of days. If that's the way you want me to head, I'd rather do it during deliberations. And okay. So that we can make sure that we have everything clean for the 2021 budget adoption.
Okay, thank you. Thank you, Julie.
Robin?
Okay, so I think like Sarah said, there were 2 supplementals that came through Heartland. The 180 psychiatry supplemental, which would be to help offset the cost of bringing on the FTE psychiatrist. And then the other one, which we haven't talked about as in great detail, is a request for supplemental funding for partial FTEs on a primary care team for integrated care in the amount of $27,652.50. And so really what we're asking is a 0.5 RN and a 0.25 medical assistant to work with our primary care provider on one of those primary care teams to really help push and drive integration of care, working whether that's with that provider in MAT services or prevention or just typical primary care. What we're finding and what we continue to feel, over the last year and a half, and then it's certainly exacerbated by COVID, is a very big strain on the budget when it comes to the number of uninsured patients that we're seeing. And, again, like Mike and Patrick were talking about with the sliding fee scale, that is certainly not something we're unfamiliar with as well. I think around 50% of our patients are uninsured. And we thought this would be a way that we could help, while not directly taking away or putting those funds into what we would call our compassionate care fund, which would allow uncompensated patients to be able to reimburse, but this will actually help continue that access level. I think the thing that all of us as safety net providers want to avoid is having to stop access to new patients who don't have insurance. Under my federal grant, we have clearly met the threshold of the number of uninsured patients that we're required to see under our federal grant. So at any point, it becomes this unfortunate conundrum, if you will, where you have to look at what is sustainable, but at the same time balance that with access. So do you stop allowing new patients without insurance to come into your facility, which seems like a very unpalatable option? Or do you look at ways that you can help offset some of that funding, whether it's through a 0.5 RN and a 0.25 medical assistant? My goodness, sorry for the confusion there. But this is really a way for us to help offset some of the costs associated with seeing uninsured patients, who most are going to come on that slide A scale of, which is a $15 visit, and they don't have to pay that if they can't pay that. And so this is our request, and I'm happy to talk about it at length or go into specifics, but the goal is, any bucket we can find that's going to allow us to get some funds into the operations helps us continue to see new uninsured patients. And we are absolutely not looking forward to having to make that decision in the future. So that's why they ask.
Robin, thanks for that explanation. And I guess I do want to talk a little bit about that. And I know I get to be the administrator, so I get to worry about consistency between how we fund certain types of requests. And I do feel like we have done a tremendous amount of work over the last couple of years to really align our community partner asks with, if you as we had the conversation with Bert Nash, if you're looking to offset sliding fee scale for uninsured clients, that's a request we can consider. If you're looking to add staff, that's a request we can consider. Moving back and forth between the two confuses us. So I think as we I want to be clear, if it'd be my expectation, if this were to be funded, you would add staff, and you wouldn't be able to not add that staff or use that staff for something else unless we change the community partner agreement.
Yes, it would be for.
So I understand you're doing everything you can to kind of, make it work. But at the same time, from a county perspective, we have a responsibility to the taxpayer to be very clear as to what we're funding.
Right, and this, allow me to clarify. Thank you, Sarah, for that. This is adding staff for a new provider who will be coming on in August. I'm sorry that I did not make that very, very clear. Heartland would pay, the 0.5 RN on our end and a 0.75 medical assistant, but this would be to add the care team to go with a new provider that Heartland's bringing on in August.
Thank you.
And Robin, this isn't a one-time request. This is something we'd have to look at every year from now on, right?
You know, I really see this as a one-time request.
How so? Walk me through that.
Well, as we continue to look at ways, partly through the Douglas County Dental Clinic merger, where we're able to increase the number of patients coming in our doors as with commercial insurance, Medicaid, Medicare, Aetna, Blue Cross, United Healthcare, any of those insurances, this that helps offset the cost of the staff that come in. It's not going to be completely, but the issue in bringing on a brand new provider is a ramp up period. And so you have typically anywhere from a 6 to 10 month ramp up period as they're starting to get new patients in the door. And so I see this as a one-time request simply to allow us that full period of time, that full year for that provider to ramp up and build a panel. Once that panel is built, you know, we'll be able to offset the cost of it through private insurance, which is going to be some pretty targeted marketing strategies on our end.
Okay.
Does anybody else have any questions for Robin?
Well, thank you all. Happy to answer any questions at any point if you have them.
Thank you. And, you know, and we're getting close to, and this would give us an ability for a small break perhaps before we start our 10:15 session. I do, you know, I wanted to echo what Commissioner Thomson said earlier about the work of this team. It's our Behavioral Health Leadership Coalition and working with these partners is truly one of my highlights of my job. And so I thank you all for your time today, your attention today, your continued dedication and work to work collaboratively and work in ways that challenge our expectations of how the system is built. And I am incredibly grateful for the services you provide for our community. And I'm proud to be a part of working with this team moving forward as we continue to meet the challenges ahead of us. So thank you. And with that, commissioners, would you like a quick break before our 10:15? All right, so it sounds like a yes. So I know we've got a number of attendees coming over in our, so if we could begin to kind of move them over, we'll be back in a few minutes. Thank you so much.